It is important that I notify the nation through you that in the last 6 weeks, Nigeria has been experiencing Lassa fever outbreak, which so far has affected 10 states in the country.
This announcement by Nigeria's Minister of Health in January this year once again unveiled the chronic Lassa fever situation, which has been known to the country since 1969. In what may be described as the end of that round of outbreak which began in August 2015, about 19 states were affected with over 100 deaths.
Lassa fever is endemic in a few states in Nigeria, and we haven't been able to eliminate it yet. So there will be a few sporadic cases. There are two potential sources of infection. One is from rats, the other is from person-to-person transmission. Now, there's been a lot of focus on the rats. There hasn't been enough focus on the possibility of person-to-person transmission. This would happen, the most likely scenario where this happens is in hospital settings. And the best way to prevent this is for doctors and nurses to use personal protective equipment, so gloves, gowns, whenever they manage patients.
On the 18th of August,
the news of the death of a 54-year-old medical doctor who was referred from a private hospital in Delta State to the Nnamdi Azikiwe University Teaching Hospital in Anambra is a wake-up call for everyone that Lassa fever and indeed other diseases hardly take a break from being infectious.
Please make sure every food item is covered using non-porous containers like plastic. If you buy your sack of gari, please pour it in a plastic that you can cover and seal. For the health workers, infection prevention control, assume everybody is infectious until otherwise, to have an infection prevention control policy that you remind everybody, let's make it a minimum of monthly. Then they should have what we call high index of suspicion.
There are few laboratories in Nigeria at the moment that have the capacity to test for Lassa. However, one of the key priorities of the new leadership of NCDC is to establish a network of public health labs that have the capacity, understand the processes, and can support the country in making diagnosis of viral infections or, in fact, any infectious disease.
Regular hand washing, food and environmental hygiene should not be about being frightened, but about making these positive practices a way of life. If you have information on suspected disease emergencies, do call the Nigeria Center for Disease Control toll-free line showing on your screen. Yomi Otaigba reporting for Channels Television News.